Namaste to everyone. I hope you all are doing well, my dear friends. The topic for today, which we are going to discuss, is the commonest problem for nowadays. That is your lower back pain. So, lower back pain can be caused by other problems. So, is not if there is any injury on the lower back, any mechanical injury on the lower back, only then the lower back pain comes. It can be come by our poor postural habits nowadays, overlong or prolonged sitting jobs, our poor postural habits, lifestyle, and the nutrition, the food. It can be caused by so many different diseases also. Maybe there is any imbalance on your feet, ankle, it can cause lower back pain too. Any imbalance or any disability in your knees can lead to the lower back pain. Any hip problem can lead to the lower back pain. Any imbalance on your neck can cause the lower back pain. So nowadays, our lifestyle has an important aspect. How much active stretching we are doing, how much movement, that's people say keep moving, keep breathing. So this is good to maintain your normal spinal curvature. So many causes that is creating lower back pain nowadays. So let's talk about the lower back pain first. So when we talk about this lower back pain, so first and foremost, we have to talk about spinal anatomy. So about this spinal anatomy, when we are going to talk about, it comes to the lumbar spine. If we talk about in general spinal anatomy, spine has a remarkable combination. So spine has a remarkable combination of strong bones. That the bones are strong, that give us the alignment and keep us in one frame. Flexible ligament, so we can move forward, we can move backward, we can move on the sideways, and rotation is there. So flexible ligaments. If you talk about the ligaments of the knees, as you try to move it here and there, it becomes more wearing and tearing with the ligaments. Because this knee joint has limited range of motion, flexion and extension. But the spine, it's moving on the different directions because the ligaments are flexible. So spine has a remarkable combination of strong bones, flexible ligaments, and highly sensitive nerves. The nerves are highly sensitive, which take the impulses. So through the spinal nerves, the impulses is going to the brain, and from brain, it is coming to the body. That is the messengers that takes the impulses from body to brain and back from brain to body. So when we talk about this spinal anatomy, it comes to the lumbar spine, has a curve over there. So lumbar and sacrum, right? The lumbar and sacrum. So 5 lumbar vertebrae we have. 1, L1, this one, L2, 3, 4 and 5. This 5 lumbar vertebrae, and from here the sacrum start, which is fused. Right? From here the sacrum start, which is fused. So lumbar has mobility too. Sacrum has little mobility. It provides stability through the ligaments to your hip bones too. So if any problem comes to the hip bones in the side, there is sacroiliac joint on the side. If the ligaments get overstretched, it can also cause the lower back pain. So lumbar spine 5. 1, 2, 3, 4, 5. Sacrum is fused here, right? The sacrum is fused. So lumbar has mobility, sacrum has less mobility. From the side, because the sacrum is providing support, the stability to the hip bones also by connecting through the ligaments. So spinal has mobility here also in the lumbar, but the sacrum has very less mobility over there. So guys, that's why we say that the lower back pain, when you are sitting over there, most of the stress or the strain comes to this area, and on your sits bone here. So this is about the anatomy of your spine, that we have a remarkable combination of the strong bones, flexible ligaments, and highly sensitive nerves. Now, if we talk about the causes, that what are the causes that affect our lower back pain more? So in the causes, there are several causes that we call lifting of heavy weights and objects. So the person who has an activity, that's why we say if I'm bending forward and trying to, the pen is dropping here, if I'm going to do it like this in the long leverage, so the whole stress is coming to my lower back in these muscles here. It is already tight and sometimes it's weak. If I'm trying to hold it like in the long leverage, I can see I cannot able to reach. I'm trying to overstretch these ligaments or the muscles from here. But when I just break the leverage, I'm dividing the load on the different joints also. When I'm bending forward directly and trying to hold and lifting something, the whole pressure is coming here because of this tight hamstrings. But when I'm dividing that stress or this weight bearing on the different joints, so the lower back has less stress or the less strain over there. So if I'm trying to hold and trying to grab the thing like this, so you can see back is stable, the pressure is dividing or the load is dividing to the knee joint, to the ankle also. So this is the mechanism that which we can prevent lifting of heavy weights and objects every day. If we are doing it that way, every day lifting and there is no exercises, muscle become weak after some time. And there is more chances that the condition becomes more worse. Then we have a degenerative conditions. Right, the degenerative conditions. So this degeneration has to happen as the age grows. But nowadays, because of our lifestyle, you have seen that this degeneration comes early. Right, the degeneration comes early. Lack of mobility, not a good nutrition. So this bone becomes more degenerative every day. After the 50, 60, it has to become that the degeneration, this is the process, has to be get more and more. But if we are doing several exercises in the activity of daily living, we can slow down that degeneration process at that age also, in the 60s and the 50s. But in this age nowadays, if you see, after 15 years, after 20 years, because of the technology which we are using, lack of mobility, lack of sports activity nowadays, using mobile phones, playing games, in the IT workers, if you have seen 8-hour sitting jobs. So that degeneration starts early and that leads to the more conditions. That can lead to the spondylitis. That spondylitis, if we talk about, this is the inflammation of the joints between your spine. This is the joint between your spine. Here it becomes inflamed, the joint between your spine. Spondylosis. In the spondylosis, what happens? This is the condition in which we can lose our natural curvature of the spine. Stiffness, tightness, numbness. It creates the pressure on the disc. It creates the pressure on the disc and nerve issues can be occur. So degeneration, this arthritic changes starts. You can loosen up your shape of your spine in the spondylosis, the normal curvature, and which create the pressure on your nerves. It starts from the spondylitis, that is inflammation of your spinal joints. And slowly, if you are not focusing on that, after some time it can lead to spondylosis. So your curve of the spine gets changed, the bone learn how to grow in a different alignment. When we can say during pregnancy, the lower back pain comes if the muscles are not prepared. During menstruation also. So pregnancy, menstruation, during the early or the beginning of the 3 days, the women have more cramps because of the lower back muscles are weak, your abdominals are weak, the whole core is weak. And if we are not strengthening it every day, pain becomes more worse. So if you are strengthening some exercises, practicing some exercises, not while you are menstruating or while you are pregnant. That's why we say pre-pregnancy, post-pregnancy. So if you have a good teacher, the good tutor, through which, or if you are a yoga practitioner, you know about it, when you're getting pregnant, so preparation needed over there. And in the pregnancy also, you can do some stretches, some exercises too, to avoid this lower back pain. And same exercises we don't have to practice only when we are menstruating. After menstruation, if we are focusing that why this pain is occurring every time, for my first 2 days, 3 days, this cramps. After that, if you are practicing some abs exercises, abdominals, simple exercises, the pain will go away easily. And you feel less cramps, less pains while you are menstruating. Sometimes there is a muscle strain. So muscle strain, the people who is working every day, lifting heavy weights and objects, muscle become more stress. So the strain comes to the muscles and it will last and long forever for the longer duration of time if we are not practicing it properly, some exercises. So what is the counter for that? If you are only lifting, it becomes more stress on your lower back, my dear friends. So these are some common reasons which we can say our lifestyle nowadays. That is your sedentary lifestyle, lack of movement, and nutrition. Right? Sedentary lifestyle, lack of movement, blood circulation impairs. Then your nutrition, what we are eating, the time of eating, how much nutrition we are carrying. Are we going through the junk foods or some packed foods? Are we taking enough amount of calcium, minerals, irons every day or not? Magnesium also. So these all contents we needed to become more into the healthy life, to give some good nutrition to your bones, muscles and ligaments too. Then we can say sciatica is the one more common thing. The nerve compression. So this sciatica, the nerve compression, nerve impingement, that also can lead to the lower back pain, and the pain radiates from the lower back to your toes. So these are some reasons, some common reasons which we can consider, that lifting of heavy weights and objects, some degenerative conditions like spondylitis, spondylosis, pregnancy, menstruation, muscle strain, lifestyle, sedentary lifestyle, nutrition, and sciatic nerve compression. So these are some common causes which can lead to the lower back pain in further conditions. Now, symptoms. What are the symptoms and what structure is involved? So when we talk about the symptoms, so when the pain felt at a single point or over a broad area. So when the pain felt at a single point or over a broad area, mostly people have this complaint that sometimes they complain, I am feeling pain on this part, or sometimes I'm feeling a pain in this area or in this direction on the one side, sometimes on the both side I'm feeling the pain. Sometimes people say, I have a dull pain. If you ask the type of pain, I have a dull pain. Whenever I am in any movement or in any position, I am feeling some dull pain over there. Sometime when I am sitting and I am trying to stand up and walk, I feel that pain also that time. When I am lying down, I am feeling the pain. So this dull pain occurs for the longer duration of time. So when we just sometime get our focus away from this symptom, when it is in the single point or the broad area, it can lead to the dull pain also. Sometimes people has a complaint, radiating pain, sharp shooting pain, burning sensation, and sometimes people complain numbness and tingling. So these are the some other reasons or some other symptoms which we can say when the pain felt at a single point or over a broad area. Dull pain, sometimes pain radiates from the lower back to the hip, from the hip to the knee, from the knee to the toes. Sharp shooting pain, it is coming, going up, coming, going. So it is sharp shooting. Burning sensation, you feel like something is burning inside your lower body, the lower limb. And you feel numbness, like pin-like sensation, and the tingling sensation also. So when this first symptom, when it is at a single point or over a broad area, it may be due to the muscular involvement. We can say due to muscle strain. Right, the muscle involvement, the muscle strain. When there is a dull pain, which the pain persists for the longer duration of time, ligament is involved. The ligament involved. When we're talking about the radiating pain, so when the pain radiates, it is because of any extra stress, maybe due to this, the pressure comes to the disc, the nerve endings. Right? The pressure comes to the disc, and disc creates the pressure on our nerve endings, so nerve compression. Or maybe sometimes disc involvement when the disc prolapse, slips, or herniates. Same thing, it comes to the sharp shooting pain, burning sensation, numbness, and tingling. So these all four together can be due to any nerve involvement when there's an excess pressure on the nerve or disc involvement. So we can say for all four nerve or disc involvement. So these are the symptoms when it is in the single point, broad area, muscle is involved. Dull pain, ligament involved. Radiating, sharp shooting, burning, numbness and tingling, there is involvement of your nerve or disc. So now guys, we come to the disc. We have a potential disc problem nowadays. As you have heard about it, the disc compression, right? Disc herniation, disc prolapse, slip disc, degenerative disc. So many conditions that can be happen with your disc. If you are not focusing properly, not doing active movement, a good set of exercises every day, yoga poses, the degeneration becomes more earlier. So before to start that disc, potential disc problems, we have to learn about what is disc first. So disc, when I talk about, so this is the structure of the disc inside. It is made up of 90% of water. So that's why we call it jelly-like fluid. It acts as a shock absorber. So it is made up of 90% of water and it acts as a shock absorber. So sometimes the jelly, this is the outer covering of the disc, the inner covering of the disc, right? This is jelly which floats. Sometimes this disc get more scattered, right? More scattered when the extra pressure comes to the disc. When the extra stress comes to the disc, it becomes scattered more. When this over happening happens, mostly in your daily life, you are putting extra stress, overuse, overpressure. Sometimes it gets ruptured and this jelly becomes out. So herniation can happen and this fluid can move anywhere in your body into the multiple level of your spinal cord. So basically in the disc, that's why sometimes when you're lying down on your bed into the night and as you wake up in the morning directly out of the bed without doing any movement. That's why people say that don't come out the bed straight away. Directly don't try to come out from your bed. First do some movements because from the last 6-7 hours, this jelly, this 90% of the water can go anywhere in your body. Sometimes you're trying to lift up heavy bucket in the morning, muscles are not open, not prepared, so the pressure directly comes to the disc and your back stucks like this way and you cannot move anywhere. So the joints become interlocked and the prolapse of the disc. So there are some potential disc problems which we have. So in this potential disc problems, so as we know, the disc has square shape in between the vertebrae. So this is the shape of the normal vertebrae. In between there is a disc. The blue color, this is the disc. These are the two vertebrae. When you're talking about this prolapse disc, so the prolapse disc, when it comes away, out or scattered, that we call the disc prolapse. In general term, you use slip disc also, the slip disc. When we talk about the disc compression, so the space between the vertebra reduces and disc get compressed. The shape and the size of the disc compressed. So that we called about the disc compression. When we talk about the disc herniation, so the fluid inside the disc, so the disc become ruptured and the fluid get out. This is we called disc herniation. Then there is a disc degeneration. The shape and the size of the disc get degenerated. So it is not in oval shape, it changes, disc degeneration, and the shape of the vertebrae also get changed. It becomes also degenerated. So the square shape has lost and it becomes more degenerated. So guys, if we talk about the disc compression, right? Disc compression, disc prolapse, disc herniation and disc degeneration. So suppose this is we are looking from these are the two vertebrae, that is my blocks. My block is two vertebrae, in between that belt is the disc. So nowadays mostly we use our body in this plane, right? Mostly in the forward plane, in the anterior plane. So when we're talking about the disc prolapse, so when the disc prolapse, it can goes more forward, more forward, more forward. So that's why I say when the problem with the disc, we have to avoid forward bending. If you're looking from the front, the disc prolapse like this. If you are doing forward bending more, it becomes more prolapsed. That's why we say not too much rotation, because it can go here, it can go here also. So we have to avoid the forward bending poses in yoga when there is any disc involvement. Now how we can say, so in the disc prolapse, slip disc, we can do some yogic poses, but when we have a confirmation or any medical prescription. But in this condition, be aware, because when the disc herniates, it slips out and the jelly moves anywhere. So maybe the problem starts with the level of L1, L2 in between. And you're doing yoga poses, this jelly can move to L3, L4, L5 and affects all the nerve roots. And then the pain can radiate anywhere. The disc compression, when you fall down sometime on your back, or you're sitting on this posture for the longer duration of time, it compresses your disc, reduces the space between your vertebrae and extra stress that comes to the disc, and the disc can create the pressure on your nerve endings. Your ligaments becomes more tight and sometimes more loose also. So what is disc? If we have to learn about the disc, disc is not like if we are telling that slipping of the disc. So disc doesn't slip like it jumps and goes forward. If you have seen the balloon with the full of air, right? The balloon with the full of air, if you're trying to press it, what happens? Scattered on the side. Scattered from the side. So same thing, disc slip doesn't mean that disc is here and it moves from their original place. So disc is like a balloon which is full with air. If you are trying to compress it, it's scattered and spread more. Right? So it increases their surface area and creating the pressure on the other related structures. Right? It creates the pressure on the other related structures. So this is the problem which we call slip disc, and when the slip disc you are not focusing, no exercises, not prevention, then also it can lead to the disc herniation after some time. And sometimes disc herniation also happens when you fall down somewhere or you're lifting any heavy weight, suddenly the disc herniates, it punctured. This problem can occur, the disc degeneration, when you have a lack of movement, not a good nutrition over there, more sitting jobs, standing jobs, no exercise for the spinal muscles. The bone learn how to grow in the different shape. The disc become degenerate, so loosen its original shape. So these are some disc problems, the potential disc problems. So this is the normal one, disc prolapse, disc compression, disc herniation, disc degeneration. So in this condition, disc herniation, guys, be careful. Until we don't have any medical prescription from the doctors, please be aware. And if you are a good yoga practitioner and practicing since a long time, you can continue, but must have a good eye with the symptoms of your students. So now, most of the time, the question comes. What the question comes? What we have to do or not? So mostly, how you know this is the muscle tightness or the disc problem? When you ask the person to bend forward, right? Bend forward, bend forward, bend forward. While the person is bending forward and feeling pain, I'm still having a pain, still having a pain, still having a pain, 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 pain. As you ask to bend your knees, no pain. So this is the muscle tightness. Right? The strain on the muscles or the muscle tightness, that's why this pain is here. Ask the person, then you ask the person, bend forward, bend forward, bend forward, bend forward, bend forward, pain, 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 pain. You ask the person, bend your knees. Still the pain is same. This is the involvement of your disc. Maybe the starting of the degeneration of your spine, starting of the disc compression, starting of your disc prolapse. So this way also we can check generally in your regular classes too. So on the tightness, if the muscle is tight, you ask the client, bend your knees, pain disappears. You ask the person, bend forward, bend your knees, still the pain is there, disc involvement. So these are some conditions, and basically we have to avoid forward bends. The forward bends, I'm not saying that complete forward, you have to avoid complete forward bending, right? Like this way. When you get slowly and slowly the strength with your muscles, my dear friends, we can go with the forward bends also. So generally we have to go with little gentle backward extensions. So you can bring the disc back to the normal place. And you can engage these muscles which we very lessly use in our activity of daily living. So when we're sitting job, these muscles get prolonged passive lengthening here. So some strengthening we needed on the lower back extensors, the spinal extensors. Twisting we can do, you have to twist from the upper back, right? So the mobility of your upper back spinal muscle doesn't affect. But don't twist from the lower back. In the sitting position, you can gently twist from the upper back. But not with the extensive twist. You don't have to go with more advanced twisting poses when you have a lower back pain. So slightly get some mobility on your upper back muscles, which can release the pressure from your lower back spinal muscles. Gentle side extension we can practice gently without creating any stress on the lumbar spine or the lower back. And gentle spinal extension exercise, the backward bending we have to use more with our students. You can go with some gentle stretches also with the help of the wall, not going forward bending. Just try to bring your spine 90 degree, neutral extension, only extension, this we also can do. But when it is going like this way, forward bending, then the pain comes more. You can keep your spine horizontal, 90 degree, and try to stretch your buttocks back, stabilize your shoulders, and you can hold this stretch also. This stretch you can do with the chair too, like holding the chair. Don't keep your ankle forward, spine slightly back, horizontal spine, and stretching your hips towards the wall. So this stretch also, which we can practice the problem with the disc. So the guys, lower back pain has a different signs, different symptoms, different causes. So we must have to be aware, go with the gentle static poses, not with the more dynamic. So the person can be in the problem and the condition becomes more worse. So I hope this must be clear to you, some lower back pain and potential disc problems, causes, symptoms, how you can get notified that, and how you can isolate if the muscle is involved, the disc is involved, or nerve is involved, or any other soft tissues which connect the muscle to the bone or bone to bone, that is involved, that is your ligaments and tendons. So a general brief overview about the anatomy, sign and symptoms, and the potential disc problems. So I hope this must be clear to you. So till then, enjoy your day. Namaste. Have a nice day.